Welcome to the Rewilded Human Podcast, where Dr. Lucille, holistic psychiatrist and psychotherapist, and Dr. Lynn, naturopath and nutritional consultant, help you reconnect with your true self. Through practical tips on mental health, nutrition, exercise, relationships, and spirituality, with a dash of humor, they tackle today's toughest issues to guide you back to a harmonious, vibrant life. Rediscover your natural self, just as nature intended.
So as you're getting on in years, maybe you're noticing that your balance is a little bit off. You're not quite as strong as you used to be. Maybe you're getting a little bit anxious about moving too fast or moving too far. Well, these may all be signs that you're at risk of having a fall. So on today's episode of the Rewilded Human Podcast, we are going to address this issue with Dr. Kunjal Dharod. Now, she's a private practice physical therapist who specializes in fall prevention. And her motto is that she's there to help seniors stay strong and independent. So in this episode, you're going to learn what the risk factors are for falls. What are the consequences of having a fall? Dr. Kunjal shares her protocol for how she assesses people, and it's very extensive and very comprehensive, and she is looking for absolutely everything within the individual and in their environment, in their social milieu, that could make them at risk for a fall. And then she develops a very comprehensive plan that her clients can follow so that they can literally prevent ever having a fall. In her words, falls are not normal. So sit back and relax because you are in good hands with Dr. Dharod. You will learn so much about falls and fall prevention so you can develop the confidence that you can live the rest of your life with that strength and independence that you desire.
Dr. Kunjal, welcome to the Rewilded Human Podcast. We are so happy to have you here with us.
I'm so excited to join this conversation. Thank you for having me here.
Thank you so much. And this is such an important topic. This is something that people don't talk about too much. So I was really happy to see your website, your page on Instagram, and that you do address how detrimental falls can be and all the many ways that we can actually prevent falling as we're getting older. And our audience is primarily ladies over 50. So this actually is very important for them to talk about. Let's begin with some of the serious effects that people don't really think about. Like they think it's just a fall, just a broken bone, just a hip. But really a fall can have really serious ramifications. Can we start with that?
Yes, definitely. So sometimes even before that broken bone or even before that fall actually happens, people are moving less or not even noticing the signs that they're about to fall. Before a fall happens, you are given so many alerts and your caregivers can notice so many things in your body. But most people sadly tend to avoid it and consider it as normal part of aging.
Can you name some of these things for us?
So like before they'll start taking shorter steps when they're walking, like being really cautious when they're walking. Some people will start furniture walking. They'll hold on to furniture when they're walking. Yeah. They'll think twice about stepping over a curb. They will want to hold on to somebody. And it's in their head. They're just afraid of moving overall. They'll maybe, stop going out less. If they're feeling fatigued or tired or weak, they'll just consider it as, I'm just getting old. It's my age. So those things, aging is so normalized as being pathological, which it's not supposed to be. It's not pathological.
Absolutely.
So that it's just so natural for people to think that this is aging, that they don't even think that, no, I need to stop, think and work on this. I can change it. And then to your point, it's not just the physical injuries that impact the falls, right? Not just the broken bone, not just head injuries. It's a lot of things. It breaks you as a person. It changes your identity. You're no longer You're no longer doing the things that you enjoy. You're not no longer going out with your friends. You're no longer just being an active participant in the community. You're not, if you loved cooking before, you're not going even to the kitchen to stand for 15 minutes and cook. You're not, it changes you. It changes your whole surrounding, right? Your environment, your people around you. They're worried about you. It affects their life too, caregivers' lives, families' life, your adult children's lives. So it's a lot bigger than just a broken bone. It's
Right.
falls are
So it's a tremendous loss. It's a
it
tremendous
is
loss of a
it
life,
is
really.
it is.
It's huge. Must involve quite a bit of grieving. I would imagine that you can no longer do what you did. You're no longer independent. You have to rely on people, etc.
Yes, you just lose that joy out of your life. Now you're just waiting for that day to come when you're
Yeah.
just waiting
Yeah.
because this is the way of life you've accepted. This is what aging looks like for you now.
Yeah, it's
So
very.
yes, so let's, if you could get back to the negative ramifications, like what happens, you started talking about it, but what are all the things physical, emotional, and perhaps even spiritual that occur as a result of a fall?
So just in your day-to-day life, right? People are afraid to when they're afraid of falling or when they know that they're feeling weaker and aging, they won't even go outside to get their meal independently. Imagine how restraining, how confined that is mentally, physically. Your world is getting so small every day,
Mhm.
so small, physically, emotionally, and then because you're not moving as much, you're falling even more weaker. Your
Yeah.
reflexes are slowing down even more. Your flexibility is declining. You're declining cognitively if you're not moving. You're becoming, for the lack of a better term, you're just becoming grumpier.
Yeah, for
People don't
sure.
want to be
Yeah,
around you
For sure.
anymore.
right.
And you don't want to be around people who are not aging or who are,
Vibrant
doing,
and
Yes.
still
yeah,
doing their things.
who used to be your friends and you used to be one of them, but now you're not. So it's a very, very big deal.
I've read some statistics that if you fracture a hip, that you have like 50% chance of not living past 2 years. 2 years.
2 years.
I mean, that's pretty scary. That's a very scary thought.
It's very, as I said, it's and after the especially after the age of 65. So
Hmm.
if you broke your hip after the age of 65, there's a 50% chance that you will not survive after 2 years.
Wow.
It's a
That's,
big deal, and it's
yeah. And
not
65 is young. 65 is not old anymore.
it's
That's a young
nothing.
age.
It's nothing.
Yeah.
So,
Is
and
it
it's
also, is
not
it
even
also
quality
true?
of life. You'll just won't survive it. How huge is that?
That's,
Hmm. Hmm.
is it, I've also heard that it's a lot of times it's not actually that you fall and break your hip, but your hip is so fragile that your hip breaks and then you fall, but it's actually just falls apart on its own without any impact or anything.
So many people who are living with conditions like arthritis, osteoporosis, or
Mhm.
even osteopenia, right, where you're deficient in calcium, vitamin D, your bones are already weak. And because you haven't trained for it, your muscles are weak too. You're not supported properly. So when you fall, you really fall.
Yeah.
You broke it.
Hmm.
Yeah.
Hmm.
And then to go into negative and then build back up, it's very hard. But
Yeah.
if you were strong to begin with, and if something happened and you say fell and you
Mhm.
broke something because of weak bones, a health condition, it would be easier to rehab. It would be because you didn't go into negative. From
Yeah.
5, you came down to 3, and now it's easier to bring you back to 5.
Yes.
Hmm.
But if you started with a 1 and then the fall took you into -2, how hard would it be to even bring you back up to 0?
Okay, so what that sort of suggests to me is like what are the risk factors? Like what you've mentioned a few of them, but who are the people who are most likely to fall and have a serious consequence as a result? Like I guess they're not going to be marathon runners,
No.
right? Hmm.
No. So not accounting for the accidents that happen, like, natural accidents.
Yes.
Right.
But people who are 65, even 55 plus, who are not in the greatest of health, who have other comorbid conditions, like they have arthritis, they have hypertension, they have diabetes, they have Parkinson's, or they've had stroke, because it affects a lot of things, right? Like a stroke would affect your coordination, your strength, sometimes even cognition. Like Parkinson's will affect how you're moving, or diabetes will affect how you're feeling, your sensations. Hypertension will affect how your heart and body are working when you put it under stress, right? So the people with multiple comorbidities are at the highest risk of
Right. Yeah.
highest risk of falling. But again, it's not preventable. You can prevent it. Even with having everything that I just said, people still can train to not fall.
Right. And would another risk factor be being on medications, because so many of them have that side effect of lightheadedness, dizziness, and
So we
so
call it
that's
like a cocktail, right? A lot of
right.
people, especially here in USA, I see, I've worked with thousands of people, and most of them are what we call as on polypharmacy level of
Right.
medication. They are, if you're taking 5 or more medications, there is a higher chance that you will fall, because a lot of them have come with unwanted side effects, like dehydration, dryness of mouth, causing lightheadedness, dizziness. Especially medications like antidepressants, antipsychotics, tranquilizers, some hypertension medications. Those are putting you at higher risk of falling. But again, if you're feeling those side effects, you should be talking to your physicians, adjusting the dosage of medications. There's always another drug that's more suitable to your body. Not every
Right.
drug is made for each body. So yes, medications. So fall prevention is a lot of things, right? Medications are
Yeah.
part of managing your medications, how you take them, when you take them. Are you taking them as prescribed? Are you taking the correct dosage for your body? Are you taking it at correct times, like 45 minutes before meals, or whatever they are prescribed it for you? So a lot of, even under medication, a lot of things apply.
Right.
What
Are you
about
taking are you taking anything other than the medications that are prescribed to you, like natural supplements or herbs? Even though we know that they are safe and we think that they are safe, sometimes how they interact in our body with each other
yeah,
Mhm.
is unknown.
of course.
So it's your habits, your medications that counts. So yes, polypharmacy. It's a very huge deal here in America. Polypharmacy.
Yeah,
It's actually
absolutely.
considered when we do the fall risk assessment. It's one of the major questions that asks you, are you taking 5 or more medications? Doesn't even
Right.
ask which ones you're taking.
No,
If
Right.
you're taking
Yes.
5 or more, you are at a higher risk
Mhm.
of falling.
that's
Right.
so interesting. What about,
Yeah.
we're very big on quantum biology, as you probably know from my page. And what about like vitamin D levels, sun exposure? Do you see that in those people that have very low vitamin D levels and they're staying out of the sun, super white skin, they don't tan, they don't go outside? Do you see a higher rate of falling with those people?
So a higher rate of falling, I don't think it's a predictor of falling, but I know that it's not helpful to not have your vitamin D
Yeah,
at a appropriate level, or it's not helpful to that you're not going out in the sunlight for anybody.
of
Forget
course.
about. So I don't know that it increases your fall risk per se, but I know that if you fall, it's not a helpful thing, that you
Yeah.
did not have your levels in check.
Yeah, well, for strong bones, vitamin D is very important. So obviously,
100%.
also for healing, for example, after a fall, the steps that you take would also be very important to spend more time outside in the sun, get more natural
Yes.
vitamin D, and everything else. Can we talk a little bit about your protocol? What you do with people, how you help them, primary, what kind of people are you dealing with, what age group, and how are you able to help them recover after a fall?
Sure. So when people think of physical therapists, they think that, we just hand out exercises, that's what we do. But
Yeah.
physical therapy, and especially what I do, fall prevention, is a very large area. It combines of so many things. Exercises are a part of them, a huge part of it, but the other major part of it is, so say if I came to you, I will give you a head to toe assessment of your body. So it will be all of your systems, your sensory, your vision, your strength, your balance, your flexibility. I will look at your home environment, because that is also one huge part of fall prevention intervention umbrella. So I will look at your home environments. What are some places that your puts you at a higher fall risk, like loose rugs, poor lighting, cords, clutter, grab bars, access to grab bars, stairs without handrails, stairs with handrails. What are the
It's like
areas?
child proofing your home again, but for
Fall proofing,
yeah,
yes,
yeah.
like fall proofing your home.
Elderly proofing, yeah.
Yes, then I want to look at your daily habits. How much water are you drinking? What medications are you taking? What time? Where are your medications located? How far do you have to bend down to put on your clothing? Where is so your daily habits? Are you using any assistive device? Are you not using any assistive device? Are you so that then I will look at your medications. I want to talk to your doctor about making a perfect plan with what medications you're taking, what health conditions you have, and how I can framing upon my assessment how what causes in your body, what are the causes for higher fall risk. So I will look at that. And then I also look at your support systems. So
That's so important.
family,
Yeah.
friends, community. So it's this whole picture. I create this whole picture of you, a whole you in my head. And then I give you recommendations, or any expert fall prevention physical therapist will do that. They have to give you a whole recommendation, not just exercises. We have to give you a blueprint on how to change your life, not just exercise, not just strength, not just balance, how to change your body, the way you're treating your body, the way your environment, your habits, and what support systems you need in place to live independently and confidently. That's what fall prevention is.
So
It's
you
not
start with the prevention. So it's this whole package of how to go through their whole
Yes,
lifestyle and everything, and how to, because the best
100%.
part is really to prevent the fall, because once the accident happened, it's much more difficult, as you mentioned, to come back from that, and the recovery is much more difficult. And how effective is it, with your method and everything that you do, how effective is it in preventing falls for these people?
If you follow it to the T, 100%.
Wow.
You will not fall because of non-accident. So as I said, not counting the accidents,
Yes, of course.
right? But
Yes.
if you're strengthening this, if you're using all the modifications that I suggested, if you've made the changes to your home, if you've made those daily habits a part of your life, and of course I'm not God, I cannot say, sorry, I shouldn't have said 100%, but you will feel confident that you're not going to fall. You can get that life back in you,
Yeah.
that you can move confidently, you can enjoy good years, you can enjoy good life the way you're
So
supposed to.
how many
It's
how many
science,
of your
it's not magic, it takes time. It's not like if you have me come see you, you're not going to fall from tomorrow. You
Yeah.
have to build those habits. I want to be there, hold your hand through that change. I'm going to do that, because I'm not handing you something that you take and just put it in your body and poof, now you're not falling. You have to work with me. We work together to build habits, to make changes. When you were a kid, your life looked different than when you were a teen versus when you were an adult, and now you're older adult. Your life has to look different
Yeah.
to be safe and to live the way you're supposed to.
given that, which is absolutely realistic and very, very important that you've nailed that down so thoroughly. But what percentage of your clients actually do comply fully with your recommendations? What percentage would you say?
It is a lot of them won't, because some people have other mental health conditions too. A lot of people don't
Right.
have the support systems that's required. A lot of people don't have the resources
Mhm.
that they're needed. But my job up until now, my work experience has been working for insurance certified, that's what I've been doing. So when I jumped into private care, this was my mission, right? I wanted to do things that insurance wouldn't allow me to do. I want to see you more. I want to work with you in areas where it's not billable. I want to give you my skills. I want to work with you to build those things that you don't currently have. Are you depressed? Are you unmotivated? Let me help you out. Let's talk to your doctor to treat your depression, anxiety. Let me help you find community. You don't have support system. Let me help you find community resources. You can go to senior center. You can do this. You can use technology to your advantage. You can check in with me. You can set up a pill reminder. You can set up exercise reminder. You can, so I can do, it gives me freedom to do a lot of things that insurance did not allow me to do
Right.
before.
Exactly. Yeah. Yeah.
Sorry.
No.
So when you ask me about compliance, how many people are able to comply, it's very different when you're working under, you're not motivated to do a lot of things in that 5 visits that you're assigned, approved. I'm
Right.
allowed to see one person for 5 visits, or
Right.
say 10 visits even. It is hard to build habits.
Absolutely.
It is.
Absolutely.
So
I can understand how you would get so frustrated working under a system like that. And you feel like you're not really serving your clientele.
no.
Yeah.
So for me to really help you and to build those small habits step by step, I
Mhm.
need time, and that's what will get me compliance from you, because now you're motivated. You're
Mhm.
seeing the change that even that one small step gave you.
Mhm.
So if I've tasted that success, I will be more motivated to do it. I'm not going to, because I only have 5 visits, I'm going to have to give you 10 exercises to practice every day, which nobody loves. Even I don't love. So
Right.
now I'm able to give you two best exercises that will suit you right now to get you started. And you love to do that, and you'll do it. And then next time when I see you, because you love to do it, you will do two more that I'll give you. I
Can
gave
you
you
tell us
some.
about the exercises? What kind of exercises you recommend?
So everybody again. So everybody needs different exercises depending on where they are right now,
Mhm.
depending on what conditions they have right now. So for one person, I can say for your strengthening, you need squats,
Mhm.
but other person may not tolerate it. So for them, I will have to give them mini squats, wall squats.
Spots.
Somebody will tolerate 15 repetitions, 3 sets every day. Somebody will tolerate 8 repetitions, 1 set right now.
Mhm.
Just start there. So I really have to look at you, your form, your posture, your current health to give. It's like medication. I have to prescribe it to you.
Mhm.
You can't. There are thousands of videos. You'll find it on YouTube, on Instagram. There's so many online programs that you can subscribe to, monthly ones. There are CDs available. I'm not. It's good. The messaging is good. You should move, but movement is medication, but it has to be for right person at right time and right type. It can sometimes even be detrimental to just follow one exercise blindly. It
Yeah.
can cause
Right.
harm too. So
Right.
if somebody with arthritis and a poor reaction type just attended single leg standing, imagine what will happen.
Yeah.
Right.
They will fall
Yeah.
Mhm.
because they are
Mhm.
not supposed to operate at that level right now, at least.
Mhm.
That's not their baseline. So you have to start with everybody's baseline and build them up from there.
Yeah,
Mhm.
and that
So
makes a
that's,
lot, that makes a lot of
yeah.
sense. I
Yeah.
mean,
Yeah.
I talk about exercise a lot, and exercise is huge in my life. And I think it's
Yes.
the reason I'm exercising so much now at 55 is so that I don't have those issues 20, 30, 40 years down the line. And it's all about prevention. Yeah, of course, you want to look good, you want to be fit, but it's so important to me going down the line, as I'm aging, to stay fit and to stay strong and to keep my bones strong. And I think, weight bearing exercise, and that's why I love squats. I mean, squats are great, right? Because you're
Right.
strengthening your bones as well. So would you say that, for example, squats are like the king of all exercises that you're recommending? Is that like the gold standard, or it's not for
Yes,
everyone?
squats and modified versions of it, because it's weight bearing, it's functional,
Mm-hmm.
and it's strength, balance, flexibility all in one.
Yes.
Mm. Right.
And it's very interesting. They have these flexibility, or even, these movements where you get off the floor unassisted, and that will tell you how much longer you're going to live if you can get off the floor without, touching the floor or pushing yourself up. And I don't know, you've probably seen
And
those
again, all
before.
those studies are, I would always take them, with a pinch of salt, because all those studies are done on a certain population with certain health conditions and in
Yes.
certain shape, right?
Yes.
It doesn't apply to everybody.
Yeah.
So even the standardized testing that I do to assess your balance or where you're at has different scorings or different standard levels for each age group or each comorbidity. So if I say one person who scored 14 seconds on one test means a high fall risk, does not mean another person who may with other comorbidities or using assistive devices or older will be at higher risk with that number too. So again, these studies, you have to look at who that was studied on to apply it to everybody, because all the studies cannot be generalized. But yes, some of those types of studies have been found. They are a good predictor on the population that they were studied on.
Yeah, that's so interesting.
So I really appreciate the fact that you are so much going after potential root causes of a fall. It's so individualized. Thinking about it, I'm in Canada. We have a socialized medicine here. In the States, if your services are not covered by the insurance companies, and you're providing a very extensive program of treatment and basically rehabilitation in many ways. How do people pay for that?
So it's privately paid. A lot of people are able to pay it through health savings account.
Oh, okay.
Yes, and sometimes to help, if I feel like somebody is, they reached out to me, they're really interested and motivated to get this program going, but they're not able to afford this. What I will do is I will give them an option of providing them with a super bill. So it's like a bill that I will give them with the codes that will kind of integrate what I did with them. Not everything. It won't be, everything, but it will be something which they can then submit to their insurances to get reimbursed. But sadly, such is the case here, at least for now, that, insurance will be paying thousands of dollars in rehabilitation, but they will not pay for preventative services.
That makes no sense, because in the end, they're going to pay out a lot more in medical bills, right?
It doesn't.
I mean, how much they cost after when they need to do a hip replacement or anything else. If anyone ends up in the hospital in the US, it's thousands.
Can you believe they won't even pay for installation of grab bars in a person's shower or a home? Because I mean, it just blows my mind. Why won't you? Just why won't you?
Yeah, it really doesn't make any sense.
So then how do you interact? That it sounds like you would have to have a really good relationship with the family doctors or the doctors that are referring. I assume you get some referrals from doctors, correct?
Yes.
Yes.
Doctors, officers, social workers, yes.
Right. So what is that like, the relationship between you and the other caregivers, like especially the MDs?
So a lot of MD offices, they primarily serve geriatric populations. They are family practitioners. And so they really want, so sometimes they'll just ask me, can you just go and do like this one-time consultation with this person, which is not very expensive. You don't have to purchase the whole program from me. So what I will do is I'll just do a thorough evaluation and give them a detailed report with recommendations. I won't be there in person to check in with you time to time and to make modifications later in your plan, but I can give you a starting point, a jump start. And it's everything too. I'm not keeping things from you. I will give you everything that you need. You have to implement it. What my program does is it helps you implement that system in your life, right? That's the difference. That this one-time consultation, if you just call me once, I'll come to your home and I'll do all these things and give you the detailed writing, but I won't come back. That's the difference. I won't help you implement that system. But if you're motivated, it works great for people who are really, after it, or who have great support system, like, active children, or who are primary decision makers for somebody's care, then they're able to implement it in their life just fine. And it's something, right? In comparison to nothing, it's something.
Yes, absolutely. So, do you find that most of your clients come to you through MD referrals or
No.
other ways? How do the clients
No,
come to
most
you?
of my clients come to you or come to me through my Facebook and Instagram ads because,
Oh,
as I said, my services are privately paid and they are considered, because they are not considered, they are not payable through insurances, they are considered premium health services.
right.
So, so I just, I have to do this. There's no other way for me to, fund it. So I have to target people who are motivated and really ready to invest in this kind of service.
Right,
It
right.
doesn't
So,
have to be this way, but it is sadly that way.
all right. So it's a higher socioeconomic bracket that you're
Yes.
really dealing with.
Especially for the whole program. Again, as I said, for
Right,
one-time consultation, that's not very
right,
out of reach for many people.
right. I would assume that most of your clients are women.
Yes, because sadly they outlive
They
men.
outlive the guys.
Yeah, I love the guys.
They
Yeah,
do.
right.
And,
Yeah.
and and I also think that I think they're more invested in prevention versus just being reactive
Yeah.
to
Mhm.
what just happened and now I have to take care of it. I think they just women think long term, I guess. I would love to believe that. But yes, that's true. I have more women clients than.
Let's talk about inactivity for a second, because as you're telling me these stories and everything, I can't help but think about like our grandparents, our great grandparents who were outside working in the fields, well into their 70s, 80s, staying active, being outside, touching the ground. They were doing hard physical labor. And sorry, I think this wasn't such a big issue back then. I think that really kept them fit, strong,
Yes.
grounded. And I think a lot of people now, but correct me if I'm wrong, but a lot of people are, as you get older, you start to slow down, then you go out less, and you're just kind of sitting around watching TV. And most people don't even walk like 1,000 steps a day, or maybe just inside their house. And then the more inactive we are, the more prone we become to falls and fractures.
Yes. That is so 100% true. So I've met 104-year-old
Wow.
who was so no health conditions. They're like, fit as a
No
horse.
way.
Wow.
No health conditions. But so they reached out to me.
Mm-hmm.
I want to move better. I want to go out with my church friends.
Wow.
Wasn't that amazing?
That
Yeah.
is so cool.
So when you hear a 104-year-old over the phone, they're inviting you into their home, you have a certain picture, right, in your head
Yeah.
of what I'm about to encounter. But I was completely thrown at this because you know what she told me? I took care of myself. That's what I will advise you. So when the inactivity, right? So she says, if I want to be able to go out because I know if I stopped going out,
Mm-hmm.
I will be like this forever. And she said, I want to live to 110.
Wow.
And she wants to. And she said, I just don't want to, just be. I want to live. That's what she
Wow.
said. So inactivity, she didn't want to be inactive because she knew that being inactive is an invitation for all sorts of negative things in your life, not just physically, emotionally, everywhere. And so people from our older generation, 2 generations before, what they did was hard work, right? Physical
Yeah.
hard work. They did, even if they didn't know it, they did strength training.
Yeah.
They did the hard work. They ate good, the
Yes.
nutrition,
Yeah,
because
absolutely.
they worked so hard through the day. They slept well.
Yes.
They had friends, they had communities, right? Everything. They had everything. And that's why we see them in better health than we are right now. I'm 36. I'm dreading aging. So I have to, be at it right now. They didn't have to consciously put training as part of their life because they were trained in their
Yes.
lifestyle
Yes.
already.
Yes.
Yeah.
So yeah, inactivity is a big,
It's
it's
huge.
the root, it's huge. It's a root cause of a lot of things. You can not just lose your balance and you become weak. You will develop a lot of sedentary lifestyle disorders in your body, right?
Yes.
Like diabetes or
Yes.
obesity. Obesity is big here in United States.
Oh yeah.
It's huge.
It's incredible because for many years I would travel back and forth between the Canada and the US. And the moment I crossed the border into the US, the one thing that I noticed right off the bat was how fat people were compared to the Canadians. It was shocking, just absolutely shocking. And and I think it's even getting worse now.
It is.
Yeah.
Children are obese. A lot of children are
Oh
obese.
yeah.
So inactivity is a root cause for so many things.
Mm-hmm.
Mental, physical, and
Mm-hmm.
eventually financial. So
Yeah,
a lot.
Yes,
too.
absolutely.
So I'm very curious about this 104-year-old lady, right? I'm assuming she's a lady.
Yeah, yeah.
Are you able to share with us some of the things? Because you said she said she took care of herself. Like, what kind of things did she do to take care of herself? I mean, that's
So she was very lively, and she still loves to go out to do her nails every week, go out to do her
wow.
hair every week, and she's like, I cannot sit. I just can't sit. I love going out. Even she has a huge collection of coffee in her home, but that she says is for my evening dose. The mornings she has to go out to a cafe, take a book with her, read, and have coffee at the cafe because that will give her a small boost of movement every day. So, and she said, when I was young, I used to take care of my children and my husband, but I used to take care of me too. And
Wow.
That's a big one because a lot of women don't do that.
Mm.
yes, so that's what she said. Because so and so this is about somebody else. So what she shared with me was, before I a lot of times family meals weren't possible for them because everybody was not at home for the whole time. So she said, a lot of time what was important for me was to feed myself first, so
Mhm.
that now I'm happily feeding everybody else, taking my time. So I'm taking care of me first so that I have my bucket filled, and
Mhm.
now I am ready to give. I have something to give.
Mhm. Mhm.
And so self care is actually, for men or women, everybody, it's very important, because in your years when you age, that is going to pay off. You're going to need that. If you haven't taken care of your body right now, it is not going to support you later when you really need it. And
Absolutely.
sadly, in countries like USA, I come from India, so I have very different views on these kind of issues. But sadly, in USA, you cannot just always count on automatic support systems. You have to build that.
Yes, that's right.
You have to intentionally build that. So, and a lot of people are not fortunate enough to have that. So what you can only rely on is your body. And if you haven't taken care of that, what do you have?
Yeah.
Mhm.
That's actually a very, very important point because
I think so.
I think as you know, as we are aging, community, family, and connection, human connection is really important. And I think in India, this is just part of the culture that, families live together or you take care of your parents and your grandparents. And in the US, like all of North America, because I think Canada is the same, right, Lucille,
Mhm.
is
Oh
that,
yeah. Yeah.
you can have your children living on one coast and the parents on the other coast, and you see each other for Christmas or Thanksgiving, and that's about it. But I think that's unimaginable in other countries. Like I live in the Mediterranean. I'm between Spain and Gibraltar, but I've been living in Mediterranean countries for like the past 20 years. And here it's like family is everything. And,
Yeah.
people take care of each other. And when grandma goes into the hospital, like for example, in Spain, if grandma goes in the hospital, then the whole family's there. Like the whole 20
Mhm.
people are in the room
Yeah.
with them and they
Yeah.
sleep there and they will not, like the grandma will never be alone for a minute. And
No,
then you go
no.
to other countries where, the elderly are just left to their own devices. There's nobody will even
Yeah.
visit them. And I mean, I think part of healthy aging, it's really important in order to stay strong and active and fit and to have purpose to wake up for every morning. You need to have people around you who love you
Yeah.
and support you. You can
Mhm.
I do
count
see a
on.
lot of people changing locations or moving homes to live close to their family or with their family here in USA too. It's not zero, but only when they really have to.
Yeah,
So what I
Yes.
want people to understand is that enjoy time with your family, but not because you have to. You
yeah.
can enjoy great years with your grandchildren, with your children, when you can. You can, and you should. And it will be pleasant for everybody, right?
Yeah.
Caregivers and you. So
Mhm.
Yeah,
I
no,
think,
this is so. I mean, my son, he's going to be 28 soon, but I can't imagine like living in another country or far away from him. I just can't. I mean, that's our family, and our family has to be close by. And to
yeah,
me, that's so important. And I need to know that support that I can count on him when I get older, if I need help or anything. And I mean, I know 100% that he would be there for me. So that must be so hard when families are kind of ripped apart, and that becomes the normal, where, you know, your kids are living thousands of miles away and your parents are living thousands, and everyone's just scattered. And it was never like this ever before in human history.
No, and in India, we don't even have nursing homes, you know, we don't have
Wow,
nursing
you
homes
don't.
Yes.
because we don't need it. If you
Yeah.
don't have family, if you really don't have family, the neighbors will take care of you.
Yeah.
That's how the
Yeah.
society works.
Yeah.
So
There are
we've
many
never needed
societies like
nursing
that.
homes.
Yeah. Still.
That's
Yes.
incredible.
Yeah.
I think Spain is very similar. I think there are some, but I think like a Spanish family would never put anyone in a nursing home. Like that would be so shameful to do that. Like the family would be just,
Yeah,
they would never do that.
Yeah.
But I mean, how nice is that, right? And
it is nice.
especially if it's somebody that is prone to falling and they're getting weaker and they're getting more fragile, and to be all by yourself, that's a scary thought, right? That something can happen, I can fall, and then there's nobody here to help me.
Yeah. And people think about preventative care always only in terms of, you know, going to your wellness checks every year,
Yes.
and then all your blood levels are in normal, your, you know, medications are in check, and then you're done. That's what they think is prevention.
Yeah.
They never think that this can be prevented too, and this is not aging. You can take action. Balance is a skill. It's not a gift. And like any skill, it can be trained and built.
Mhm.
So people
Why is balance so
lack that
important?
awareness.
Why
I'm
is
sorry.
why is balance so important? Talk to us a
It
little bit
is.
about balance.
But balance is what humans are. Humans are supposed to be upright.
Mm-hmm.
They're not supposed to fall. Being upright is normal. Falling is not normal.
Mm-hmm.
So what is keeping you upright is your balance. That's why we have two legs and animals have four, because we are supposed to be upright. That's what we are supposed to be. We're not supposed to be hunched over. We're not supposed to be falling. We're not supposed to be walking like this. We're supposed to walk on our 2 feet.
So do you recommend exercise like standing on one foot while you're brushing your teeth, you know, to work on that kind of balance? No.
I will not do that. I
No, but I
don't
mean
do that.
when you're younger, to keep your balance, to maintain
Yes,
your
yes,
balance.
of course. To just, you know, build these small habits every day in your life. Like when you're watching TV, just do 15 sit to stands, or when you
Mm-hmm.
play catch with your friends. That trains your reactions,
Right.
your reactive balance. Do stairs without holding on to your railings. That's your dynamic standing balance. You don't really have to focus on just, you know, standing on one leg.
Yeah.
It has to be, just do functional things, right? Like
Yeah.
everyday movements, train them, make them better, train them, maintain them, if not improve, just preserve what you have.
So
Excellent.
would these be tips that you would recommend for someone to start, like even in the 40s, 50s, or what are the things that we can do at a younger age so that we don't have these issues later on?
Just set aside 15-20 minutes every day to just pay attention to your body. So like, yeah, mini squats, side walking, back walking, tiptoe walking, things like that. Or when you're brushing your teeth, sometimes just close your eyes and brush your teeth. You know, bring your feet close together and brush your teeth. Or when you're cooking or when you're bending, just, you know, do a couple of squats. When you're loading your dishes, bend from your knees and hips and do some squats there. You know, get in those quick cheat, you know, exercises, moves there. It won't give you like not rehabilitation, I want to say. It won't give you fitness training kind of level of, but it will, at least you can preserve what you're using what you have
Mm-hmm.
to maintain it, to preserve it. You're not losing it. At least we can make sure of that.
Absolutely.
So, Dr. Kunjal, can you give us an example of a client of yours that really stands out for you, that made a huge move forward as a result of your work with them?
I have so many. One of them was, so he was blind. So vision out of the gate, right? No, one sense is missing. Vision. And it's huge for balance, right?
Yes.
Absolutely.
He was using the stick to navigate. What happened was, recently he found himself stumbling, and he did have a fall. He fell. It wasn't injurious, but then he just had a bruise. But he wanted to not have that again, because again, he was very socially active too. But then once he fell, he fell into this cycle, right? Now he was afraid of moving, and with I can't even imagine what it must be like for somebody who could not see, because that fall can do a lot of damage to a person who has all of his senses in place. This person could not see. So for him, that set in a big fear in his life. When I started working with him, he wouldn't, I would give him exercises to do, and then the next time I would ask him, did you do them? Well, he'll say no, because there was nobody to watch me while I did them. So it was such a set fear that he was almost about to stop moving, and I was like, no, don't do that, because so I only gave him 2 exercises to do, and then this is what we did, right? I asked him, you do these, you set your phone, call me on video call, and then you set your phone in front of your kitchen counter and you call me. I'll watch you when you do them. And we did that. And then I just had to do it, I think 2 times. I did it 2 times, and then his neighbor volunteered to watch him while he exercised, only to watch him. And then that's how he built his confidence. And then I started giving him more and more. And then he started feeling confident that no, he's not falling. That was just one time that he fell by accident, and he's not going to fall now. We built it again. He, went back. He actually worked as a, he taught other teens who were troubled. We call them troubled, but he used to do these motivational things for them at the local recreational club. So he started doing that, and then he told his story to those. He was telling me that they were having such a fun with them, and it was inspiring to see that a simple change, a boost of confidence, what it can do for a person. And then he hasn't fallen since.
Wow.
And he was able to get it back. And it amazes me that with one complete lack of one sense, he was still able to achieve that. But what it also taught me is how big fear of falling can be for anybody, how big it can be. My mom, even, she passed away last year, but then she was so full of life, and then she had diabetes. She had many other comorbidities in her body, but she was still so full of life. But then she started falling. One fall changed her a little, another fall changed her even more. And at that time, I was in the beginning of my career when she started falling. So I knew how to rehab her, but then it got me thinking about, this doesn't have to happen in the first place. This has to stop. I mean, this doesn't have to happen, because my mom stopped being herself. She was, I knew her to be my mom, and now she was a completely different person who did not want to engage in anything. And so I was like, no, this is what I want to do. And that gradually, now it is after working with insurance driven system for so long, I am throwing my hands up. No, I'm not doing this. I'm not treating you after you fall. You don't have to fall. You should not fall. People have to
It's
know
amazing, especially the emotional impact. Like, I never really thought about it that way. I always just thought, okay, you fall, you injure yourself, you break a bone, they repair the bone, and then you're back to your normal life. But then obviously the fear and the emotional impact is also huge, and people don't really talk about this part. And it's really important.
And imagine the financial impact too. Many people are in debt because of that. Many people are homeless because of this.
Wow.
Especially in countries like here, where healthcare is almost like a privilege. It's
I know. Yeah, it's really shocking. Dr. Kunjal, what city are you in?
I am in Metro West Boston, Hopkinton, Massachusetts.
Boston. Okay.
Yes.
And if somebody wanted to reach out to you and find you, where can they find you? Where can they get more information, learn more about you?
So apart from my Instagram reel, you can contact me through my website, myjourneymyways.com.
Okay.
And I also have a Facebook page that's named under My Journey, My Ways PT. And you can reach out to me. I provide just consultations. I provide monthly programs, and my signature program is my 90-day program, where I give you all of my skills and my check-ins and my expertise through 90 days, because 90 days is the best time to build those habits and integrate it into your life and where you can see real changes.
Mm-hmm.
So that's my signature program. But we can, design a custom suitable program for you. Any need, anybody. I do in-home visits here in the Metro West area, but I also do online consultations as well.
Oh, that's
throughout.
great.
Yes.
That's what I wanted to ask you about. If you do online consultations, if someone's watching this from another city or even another country.
Yes. So I do online consultations as well. And they are designed a little differently, but then they're as effective.
Through Zoom, right? I assume that you
Yes.
and then
Yes.
you can teach
And then
everything.
I also give them a software with custom exercises for them to follow. And then we also keep regular they are able to log which exercise they were able to do, not able to do. And then we do weekly check-ins where we, go over everything that changed, what needs to be changed, how much progress we've made and such. So it's wonderful. And I think if you can, you absolutely should invest in a program like this. If not with me, with somebody else. See, get your balance assessed. That's where you should start. Get it assessed. Know where you are. At least know.
Yeah.
At least know where you are.
This is amazing. I mean, I think there's a huge demand for the service that you provide, and as the population continues to age, there are gonna be more and more people looking for this and looking for this type of support and help. Thank you so much for all the information. It was such a lovely chat. It was such a great interview to be chatting with you today.
Thank you for having me.
I certainly
love
learned a
having
lot.
this
I learned a lot.
I learned a lot too. I had no idea about all the details. So this was really, really, really interesting for us. Thank you very much.
I enjoyed it as much. It was pleasure speaking with the both of you. Thank you so very much.
Thank you so much. And thank you guys for watching or listening. And we will see you in the next episode.
Thank you for tuning into the Rewilded Human podcast. We hope you're leaving with insights to reconnect with your natural, vibrant self. Remember, the information shared here is for educational and inspirational purposes only and is not a substitute for medical advice. Always consult a qualified healthcare provider for any personal health concerns. If you enjoyed today's episode, please like, subscribe, and share it with others who might benefit. We'll see you next time, ready to dive even deeper. Stay wild, stay true, and stay tuned.